So then, all right, we'll grab our basic pack. We'll put it onto our back table. This is what we're going to want open, right? So go ahead and do that. Why am I doing it? It's your job. Like, step off my table. So Ben, make sure you have everything you need, ring stands, and you got your instrument you need to be open. Perfect. So let's grab your basic pack whenever you're ready. And I'm with you. I'm your partner in crime. So eventually, let's open that up. We'll start opening. Make sure we have masks on. We're going to open up. We're ready to rock. Again, this is just everything you've done already. It's nothing new. And if I see something, I'll just kind of point it out, okay? Right? So hold on 1 second, okay? So what I want you to do, I know normally you would open that up now. Just be aware how close you are too.
Sorry.
So we're going to wait until you get in there and then we're going to open it up. Since you have a partner.
Okay.
Think about this. Let's say we open that up. You go out and scrub. There's like a good 5-10 minute gap that's sitting there exposed.
Okay.
So since you have a partner there, right, we'll open it up when you're ready. So that's what I want you to do. As soon as that's open up, now you know what's going to be open to your field. Just get in there and scrub in and start setting up. What are we opening up? Did you verify with me? What do we got here? So this is what we want to open, right? So we'll bring it over here real quick. So, let's say hypothetically we're going to open this, right? We're going to open that. Please open. So you made a mistake. So that's a good point. Make sure you open that up first.
Yeah,
you can't.
Put my gloves on.
So you're going to have to just dry yourself off. Yes. It's the real world. You can't say your preceptor, hey man, can you open my gown for me? So we're going to open this, right? We're going to open up a drape. Put it in 3/4 and we'll hold on this real quick. So you go ahead, get in there and I'll open up for when you're ready, okay?
Like, I thought you were saying you're supposed to open that extra stuff. Am I understanding right?
Yeah, no worries. So what I want you to do is you're going to open this up, but not until she gets in there.
But I can open my gown and my gloves.
It's right there, right?
But I
Is it like what?
Like unfold it.
Is that your gown right there?
Yeah.
So go ahead and do that. Yeah.
Oh, yeah. I just didn't know if I was
No. Yeah, I'm sorry.
I got my gloves on the floor.
So you can. So what I want you to do is yes.
I feel like Chrissy told me that's the last thing I open, but I'm by myself normally.
Correct. She's going to open this up, so I want you to just get into there and start setting up. You dropped your gown or your gloves?
Normally I'd get a new pair, right?
But I don't.
Is this supposed to go toward me first?
Yeah, so what I want you to do is try not to pretend too much and just kind of like lay it there. Reset, have an extra set there, and try to open it up. But for time purposes, call yourself good, right? So go ahead and just kind of get wet a little bit and get in there. So yes, to answer your question, you always want to just kind of recap on that. You want to go away.
Okay,
So,
that's what I did.
Yeah, no worries. Yeah, so away, left, right. Don't. That's gonna have a lot of memory on it, so be careful, and try not to move it around too much. Right? It's such memory on that. It's away, left, right, and then towards you. So as soon as she's ready, kind of wait a little bit, then you can start opening stuff up to her field.
Too close?
So let me ask you a question. When in doubt, what is the parameter you have to be aware of?
I think it's like 2 inches.
Okay, so are we there?
Obviously we're over.
Okay, good. All right.
Do you want me to do a new set?
No, it's good calling out, but just kind of remember in the future, if I evaluate you, make sure you have an extra pair, and we're going to have to go with it, okay?
Now I can walk.
Yes.
Okay.
Yes. Good.
Actually, I'll help you first.
Yep.
Can we go get them on? Yeah.
It's called, yeah, I'd say, but you have to get your backside out, and if your arms are kind of hanging over, you have to come out like that a little bit, because if you're dripping on you or if you rub it up on there, you're contaminating.
I went back up too.
Yeah, no worries. So that's a good point. I would rather you not touch it. Just go to your field and I'll take it off for you. Okay. And if you have someone walking by, just say, hey, can you mind taking it off for me? Be polite about it. And don't forget to spin, okay? I'll get you a spin real quick before you go, Christina. So here's what I want you to do. Stand to the field on turn, and then just let me go around. So go ahead and, yep. Perfect. Outstanding. I'm missing so many garbages for the garbage.
There we go.
Now we're in business. So like I was telling Christina, don't worry about this. Have someone come grab it. Just go to your field.
Oh, I thought I had to turn first.
Yep, you're fine.
I'm allowed to move over without turning?
Yep.
Okay.
So go to your field and then just turn that way, right? It's going to prevent you moving around. Yep. Let her spin around you. Perfect. So like Autumn, your front is sterile, your back is not sterile. So it's okay to move to the front.
Oh.
It's just a better technique to go there. You're at your field, then have someone go around you, right?
I think I have a 3/4 drape. Or do you want to...
No, if you have one on there, it's fine. I just want to set up in the order we're going to drape. So if you have at least 2 3/4 sheets, we're good to go. One for your reinforced, and then one for the drape.
Pack already.
Do you have 2 3/4 sheets in there?
I have one for the right stand and one for the second drape. The back drape.
So we'll open up another one then. Yeah.
I always mess up with putting my second drape down a little bit.
I'm not sure what's going on here. So this is your medium sheet?
Yeah, that's mine. It's always been folded.
Yeah, it's because you reuse this all the time, and I just think that's not how it's going to happen out there.
Right.
So the whole goal of this is to, let me get you one that's going to be a real world one, and I'll show you exactly. Because trying to use something over and over is just not good practice, because that's not how, it's not going to be that way out there. And you're going to be like, wow, that's not how it is. So these half sheets, Christina, are the 3/4 sheets I call, or obviously if you get this to your field. So that's a good point. So when you're checking that, make sure you yell it out. That's very good. Check for filters, and you're both looking at that, okay? That's a redundant system, and this is your time to be vocal, okay? So you get this 3/4. So you want to center this. Go like this. Drop it.
Okay.
Drop it. And then you want to go forward first. So hold this down, and then drop it this way. Don't go below the field. And then pinch it and drop it, and then the same way forward. That make sense?
Yeah. The drape you put up here?
So,
Oh, I'm so sorry.
so I was just showing her this. Let's
Well,
hold it.
because it's not our drape we use.
I know, because those are ones that you reuse. I was just telling her those are not the ones you're going to use in real life.
So sorry.
Don't be sorry. Yeah, it's good. So here, I was just showing her. Whoops. You
That's
want?
actually the drape for the patient. That's what I'm saying. That's
Yeah.
how much I use.
Yeah, it's not big deal. We'll get another one. But 3/4 sheets, the ones that you reuse all the time and reuse those. That's not how it's going to be. So
Oh.
you're going to get 3/4 sheets that are pre-made.
Oh.
So you want to just kind of center this, right? Then fold this out. And of course, this is upside down. Center this, and then drop it. Center this way, and then drop it. It's a little off-centered a little bit.
Right.
but unfortunately I can't move it. So you want to hold this and just pick this up down this way, right? Drop it. Don't.
From here?
Yep. And don't go below the field. Just kind of drop it like this. You can go like this, smooth it out. And this way, same way to the top, right? Get into the center though. Perfect.
Hold on, I need to open my instrument.
Whenever you're ready. Yep. So while you're waiting on that, don't wait on that. Set that up, right?
You put the elements on really quick? Yeah, so we can get
So Christina, no holes, no strike through. Okay.
This is normally my.
It's okay. I know.
We're just ready right now.
Just
Use it as the-
we'll use it as a drape for the field, right? But just you have one for your ring stand now.
Yeah.
You're caught with just so.
Mhm.
Go back to that real quick. You're fine. Just this is what you did, Christina. It's not be offensive, but this is what I saw. You literally came up here and you literally pushed up to here.
Okay.
So be aware of your surroundings. You can quickly contaminate. So you need to come here. The only thing that you're going to be touching is this right this. You can't come up here and just hug the whole thing. Okay? Let's do it. Beautiful. Did you check for an indicator?
Oh. You checked before you put it on the table?
Okay. Look around. There's no indicator. Let me get one real quick. Oh. No, it's not. Hold on one second. So these indicators are normally in here like this.
So it like indicates that
So-
we ran through your
Right.
house, right?
So guys, a chemical indicator, what color is it turned?
Blue.
Or black, right? So it does change a color, right? So we need to verify that by saying chemical indicator is good. And then you can grab it, right?
Okay.
You can't put it onto your back table until I check the filter on the bottom, right?
Right.
So before you go, just be aware of your back too. I'll say, hey, Christina, no strike through, no holes, no condensation, you're good to go. And then you can go. Everyone wants to try to get it to their field real quick, right? But make sure, if you don't see a chemical indicator, what do?
You would tell the circuit.
You need to get another tray. It's contaminated, right? Or just assume it's contaminated. So get yourself ready for a count. That's all I'm looking for, okay? We're not going to get medications today. I just want you to get ready for a count.
You saying nothing?
So here's how I'm just seeing what you guys. That's perfect. Yep. Exposed. Everything looks good. Yeah. Yeah. So I'm going to show you one look. Do you mind if I show you the way I would set this up?
Go ahead.
And if you like this, but I'm just telling you, most people want to see the Mayo stand not hanging out like that, right? So I'm going to show you with
So
two.
tuck the wrong side.
Well, here's what I'm going to show you my way. You can do it this way or not, but I'm going to tuck those in.
Mhm.
And can you give me another one? Yeah. You tell me which looks better, and I'll tell you my theory on it.
Okay.
So, and you smooth that down, right? Does that nice? I mean, I'm so inattentive. Does that look nice and smooth?
It
There's,
does look. I
So-
do like it when it's smooth.
all right, there you go. You want me to show you? So what I was trying to say before, and it's not anything about Chrissy or anyone. It's just my way. What I notice, AST stands, they don't like things flopping around, and I was always shown to use two. Now, again, you might go out there and say, "Hey, I do it this way." You just have to roll with it. When you're hired, you have your own way, right? I'm just going to show you mine. Of course, you tucked that in pretty good already. Do you have another one I can borrow? So I usually go to one end first. I might spin it and do the other end. And you can do it this way if you like it. You can do it your way as long as it's not all hanging out, right? And smooth it down real nice. I like things nice and smooth. Also, if you ever get where you have a lot of sutures, you can kind of lay sutures up in here like this. Okay. You can do it that way or your way, as long as it's not all hanging out the edges. That looks good. The old towel rolls on the Mayo. So I want to have the laparoscopic drape, everything ready. So here's how I want to drape typically, guys. I want to have a down sheet, 4 blue towels, and the main drape. You need to have it ready to go in the order we're going to be using it. So get it to your field and set it up on your table in the order we're going to be using it. And if you're not sure, I can show you.
Oh, so I should open the drapes before I square off.
No, not a big deal.
Square off. Then you do the down one, like over the feet, the 3/4.
So here's how I want it. I want it, when you drape, I want to do the down sheet first.
Okay.
Then we're going to come up here and square off the operative site, and then we'll put the drape on.
Okay.
Now, I know what you're going to say is, well, we did it the other way around. The other way. I know that. I can see it in your eyes. If you read the book, that's how the book says.
All right.
I'm just telling you. So I'm going to open your drapes. Is that okay, Christina? Just be careful. I've been noticing you turning your back a lot. I know. Minus 4 points. Just joking. Here you go, dear.
Oh. So, like, in the future, like, when she has it...
So good. Go ahead.
Can I grab it from her?
Yes.
Because I'm
So
sure I
here-
totally did that.
Here's it. If it's really, really difficult,
Yeah.
you mind grabbing this for me? Is that easier than...
Yeah. True. We're so used to doing it alone.
I know. This is what I'm trying to let you know is
You're not alone.
you're not alone. Unless you're doing a small case and then you are alone. But in most cases, you're gonna scrub in on them, and people are gonna come at you like a bat out of hell and start throwing stuff at your field.
Okay.
You need to have some form of organization saying, "Hey, I'll grab that. Can you put stuff over here?" But we'll get there in a minute.
Okay.
I know it's weird but all the basic stuff, I'm just trying to teach you about teamwork and communication, and it's okay to say, "Hey, as long as you're within the sterile field, you're not contaminated." So yeah, you can grab things. It's easier that way. You're gonna have a lot of things that are flopping around. Here, are you ready to go for your drape?
You just grab it just in case I know what's in
There you go. Now, so you did hear me. So it's okay to do that.
Yeah.
It's an easier way, right? Especially things that are difficult. If you're working and I'm over here, you don't mind me throwing. I'm in your way. I can contaminate you. Instead, I'll find my time and say, "Hey, do you mind grabbing this?" Especially difficult things. So I'm going to show you in the order we're going to use it. So let me just look at this real quick, and I'll come over to you in a minute, Autumn. Is this ready to go back here?
No.
So set that up really nice.
Do I leave these in here for now? And just
Can I show you?
Yeah.
These are just preference. So what I normally do, right away, I want everything out of here. Just kind of move it here. You're not contaminating. You're just getting a clean slate. I know I have. This is an indicator what you were looking before. You know. Okay. So now I start putting things where I want them. Okay. You choose. All right. We know we have all of our sends, our rakes. Well, I'm not going to name them, so you know.
Oh, yeah, they're nice and visible that way.
It's just the way I was trained. It's easier to count. You try to get to this point as fast as you can. And then you turn to the nurse and say, "I'm ready for a count." Right? Traumatic to non-traumatic. So anything that's sharp on one side, you did that perfectly. Here's a debaki on one side. Traumatic ones on the other. I'm going to count with you in a minute. malleables. This doesn't really matter if you leave it off to the side as long as you can see it. So we have 1, 2, 3, 4. So it's easier to count. Then I use this as a kind of area where I can point to. So when I go through the count, how many retractors you have. Is that easier to count than all hub?
Yeah.
So, and it's also, if you want to move this back a little, or forward a little bit. So this is not over the edge. Now we're better, okay? You got our pool open. That looks good. So your drapes, in the order we're going to use them. So what's the first thing we're going to use?
The black one.
So it's in reverse. So we're gonna put the 3/4 down first,
3/4.
right? And then square off. That's fine. And then we're gonna put the drape on. But the first thing is the doctor, right?
Right.
Outstanding. Good job. So looking at this, making sure that the bovie is exposed. And septa goes over there. Outstanding. So what is countable on here, guys? The bovie or the bovie tip?
The bovie.
Do you know that the tip comes off? You do know that. So the tip needs to be exposed so I can see it if I'm counting, not down, just like Autumn had it, okay? And I know that's a hot mess, but
Okay.
so make sure when we're counting that's exposed. Outstanding. That looks great. Good. So we can go through a count, but let me just look at Autumn's real quick and I'll do a count with you. Turn your back again. Don't turn your...
Can we put these back in and count with you?
Yeah, so now here's the, I know it's a little different. I know Chrissy, personally, she likes to count and then put it into the tray. I want you to have it all ready to go and it all ready to go and then we count. So we're going to take everything out of here, set up your traumatic to non-traumatic forceps on either on one side here, and then start laying out your retractors.
So if it has like lots of serration,
So anything that's sharp on one side,
it goes traumatic.
and then non-traumatic would be on the other side. So if you know which side is which, so if someone says, hey, give me a non-traumatic forceps, you know it's on your left or right.
Okay.
It's just for me, that's the way I was trained.
Makes sense. Well, Russian, it has the teeth.
Russian is, yeah, has teeth. Yep. And you have your, these are just go right here, these are your knife handles. I'll give you a minute to set that up, okay?
Don't put it together.
So, yeah, so when you count the pool suction, do not put it together because it's a countable item. There's 1, 2 here, right? So we need to leave that open. Good. So lay your retractors. It's up to you. It's dealer's choice, but you kind of look over at Christina's how I have them all laid out. That's how I was
Like
trained.
this up like this?
Yeah, you can lay that right in here. It's your malleables, but lay the other ones kind of up. If that falls, it's okay. If it's off to the side here, it's fine. But these other ones, kind of lay them out so we can count them easy. When I say lay them out, just kind of.
Okay, I was just afraid of hooking on the back.
So move that up a little bit more.
Okay.
And now we're not over the field. Okay. So what's considered contaminated? Because I know you guys are like, oh, where do I need to go? What is considered contaminated? On the table, on the side of the table, 12 inches out, or below the table. So by the rule, anything below the table is considered contaminated. Or anything beyond 12 inches or 1 foot. So if this was out here, that's contaminated, right?
Okay, because it's
Or
not below, so it's
Right
okay.
there, it's not contaminated, or yes.
No. So if it was 12 inches, that's the rule. 12 inches or 1 foot. But yeah, that's probably not good practice. You probably want to have that in. Very good, right? But a lot of people say, well, I don't like it on the back of the thing like this. As long as you're above the table and you're not over the table within reason, you're good to go. You have a lot of preceptors that argue with that all the time. But that's the rule. If you think about it, in the book, that's how the standards are. So I'm going to come with you and do a count. So what I want to do is you're good to go. I'm going to go through the instruments with you, get your laps and retakes ready to go, and we'll see if you know the names exactly, and then we're done, okay? You're going to do great. Are you ready? We're going to do retakes first. As quickly as you can, retakes, laps, and we'll go into it. Retakes first.
Right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Laps.
1, 2, 3, 4, 5.
Okay. Any sutures? We didn't open any, did we?
We can open them.
Okay, no worries. We're not going to open. We'll open one. +1. I'm I'm gonna open up this tie. All right, get out. I'm gonna be over there in 2 seconds. Okay, Adam. All right, so we have 1 suture, 1 hypos.
Hypos? Like 1, 2, 3.
3. Okay. Any bovie tip?
1.
Okay. All right. So let's go with your instrument stringer. I want you to name the names as fast as you can, going from here all the way here, and then we'll move into forceps. Okay.
Okay. I put these first to mix up perforated.
Okay. Good.
1, 2, 3, 4 perforated.
Good.
1, 2, 3, 4 non-perforated. 1, 2, 3, 4 mosquito.
Good.
1, 2, 3, 4, 5, 6 curve Kelly.
Okay.
1, 2, 3, 4, 5, 6 straight Kelly.
Let me see that.
Or no, I did that wrong. It's 1, 2 straight Kelly.
Okay. What are the other ones?
Coker.
How many we got?
1, 2, 3, 4 Coker.
Okay. Continue.
1, 2, 3, 4 Alice.
Good.
1, 2 Babcock.
Good.
1, 2 Tonsil. 1, 2 right angle.
Good.
1, 2.
Don't stop. Come on. Needle drivers. Needle drivers.
Needle driver.
For sutures.
1. So needle holders.
Needle holders. They're both acceptable. Needle holders or drivers.
That's
I'm sorry. I'll be right with you in one second.
that's 4 of them, right?
Correct. 4.
Okay.
Yep.
And then
Tell me the names of the scissors. How many you got?
1, 2, 3.
Do you know? Show me a Metzenbaum. Show me a straight Mayo. Show me a curved Mayo. Okay. What's the last 2 ones?
Ring forceps.
All right. Forceps. Go with the name of the forceps. I'll be right with you guys. I'm sorry. How you guys doing? You ready for your surgery?
You said the name?
Yeah. So pick it up and tell me the names.
That is
Okay. Next one. Just keep moving. Same thing. Add some teeth. All right. Next. Okay. DeBakey. Go. Next. Another DeBakey. Next. It's okay. Don't get pressed. You got this. What's that?
rat tooth.
Outstanding. Next. I'm here with you. I want to more about these people. All right. Another rat tooth. What do we got here?
And then this one is the Russian.
Outstanding. Next.
And then the Bickle.
Okay. Retractors. Tell me the name. We'll finish strong here. Almost there.
The malleables. And then there's 1, 2, 3, 4 double-ended ridges.
Outstanding.
And then the Army Navy.
Good. It's the last ones.
These 2 are Sens.
Okay, and the other 2? Rakes is outstanding. All right. Do we have any suction? One yank hour, and do we have any other suction on our table?
The 1, 2 pull.
All right. Two pull and 1 yank hour makes 3. Okay. I'm going to count with you. Hey, guys. I'm sorry to... Are you thinking about the program?
Yeah, it'll be starting September.
Oh, that's a long way.
September.
Sorry, I'm sweaty. I mean, yeah, we're just doing a little evaluation on them. So, yeah. Any questions you have before I go into another count?
Really?
No, okay. Well, you're more than welcome to watch. I want to do a quick little count over here. You guys are ready for externships, or you're done right now? They're just starting the 3, so they're getting ready to go to externships. So the whole process of this is just getting ready. So do a lot of lab and hands-on. So if you have no questions, I'm going to move on, okay? Nice to meet you.
Nice to meet
I'm
you.
Brad.
Sarah.
Yes, ma'am. Yeah. Well, I took my mask off because I had to talk, guys. Let's do. You can start breaking down, okay? Christine, you did an outstanding job, by the way. You guys are. I have no doubt in any of you guys, but the only thing I want to do is I'll show you the ties, but maybe not today. But you can go ahead and break down. You can work with her about trying to get her case rewrapped and set up again to starting point, okay? Yeah. And I'm going to do a final count with you, and we'll finish up here. We'll do Raytex first.
Okay.
Yes,
I
ma'am.
have to fix this because they were like kind of out of order and I missed one of them. So it's out of order. So when I count, like, can I just skip over and then go back?
So we're going to go with it. So you should, for instance, if you're counting, you should know what the instrument is. For instance, if one's out of order, you say 1, 2, 3, 8 is one up here. 1, 2, 3, 4, 5, right?
Okay.
So I know
was
they're.
just making sure that was okay.
Yeah. Okay.
So you do a little bit of a control freak, so that would be
Who? It's not okay with me, but life is, you can't control life sometimes. You know that.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Laps.
1, 2, 3, 4.
Okay, we'll go with any sutures.
1.
1 is correct. Any hypos? You don't count ties.
Okay. I have 1, 2.
1, 2 hypos. Any bobby tips? You got 1.
1.
All right, let's do it. Let's go with the stringer from the left to the right. Tell me their names of them.
Okay. 1, 2, 3, 4 perforated. 1, 2, 3, 4 non-perf. 1, 2, 3, 4 Kelly.
Okay.
1, 2, 3, 4, 5, 6. Is that okay?
Let me look at it. Okay.
Oh, I said Miss. I should have missed.
No. Looking at these smaller ones, these are mosquitoes. So 1,
Yeah,
2, 3, 4 mosquitoes, and then obviously these are all. What I was going to show you guys, I don't know if I can see them. You see how I can't open them up because they got the string on it. But these is how the serrations go all the way down.
Yes.
If you can find one that's halfway, and I don't think they have.
I was looking.
These are all cryo. Oh, there it is. Yeah, that's one's only
Okay.
halfway. That's the only Kelly. That's a Kelly. That's considered a Kelly. When the serrations stop right there.
Oh, okay.
Cryals are the one the serrations go all the way down. But
Okay.
in Florida, they don't care about that crap.
So I just counted as a Kelly.
The very small ones
Or mosquitoes.
are mosquitoes. I'm going to tell you right now, these medium ones, I'm not going to confuse you, but we'll call them all Kellys.
Mhm.
They'll call them hemostats.
Okay.
The larger ones, we'll call Kellys.
Okay.
It's weird. But just as for us, as for our own purposes, we'll call the smaller ones mosquitoes and these Kellys straight or curved.
Okay.
Just for you so you don't get confused.
Okay. Do you want me to start over?
Yes, ma'am.
Okay. 1, 2, 3, 4 perf. 1, 2, 3, 4 non-perf. 1, 2, 3, 4 mosquito. 1, 2, 3, 4, 5, 6.
That's them.
These are cocoa.
The
Is
right.
that a cocoa?
Yeah.
It's not lined up. It's not lined up. Sorry, it bugged me. I thought it was something
See, it has
different.
a little teeth on them.
Yeah.
It's other covers.
1, 2 poker. 1, 2, 3, 4 Alice. 1, 2 bad sauce. 1, 2 right angle. 1, 2 ring forceps. 1, 2 needle holder. 1, 2.
How many needle holders?
There's 4.
Okay. Yeah.
4 needle holders.
So out in the world, they'll call them needle holders or needle drivers.
Okay.
That definitely
I know.
threw me off. I was like, wait,
I was like,
1, 2, 3, 4 scissors.
tell me the name of the scissors.
Mets.
Okay. How many you got?
2 Mets.
Okay.
No, it's 1 Met.
Okay. 1 Mets and what else?
And then this one is that a curved one?
Yeah, it's a Metsamom. So you have 2
This is a
Metsaboms.
Met?
So Metsaboms can be smaller or longer.
Okay.
Reason is because maybe they want to get deeper down. You have Metsaboms this big because they have to get deeper down in tissue. And them instruments are
That
long.
slight curve is what
Yeah.
signifies it.
We're not going to get into that, but I know just by the thinness of it, it's more of a Metsamom. The
Okay.
thickness of it on this one is
Well, like these are definitely
Yeah.
proof.
yeah, outstanding. All right, so forceps. Good job.
1, 2.
Tell me the names.
This is Pico Pierce.
Yeah.
This is smooth. Add some teeth.
Mhm.
Add some teeth. Right tooth.
Mhm.
And rectum. This is, oh my gosh, I'm trying to remember. It should be on this side.
Yeah, it
too.
should have been, yeah. The red tooth, right? Yeah.
Okay.
Yeah.
Red tooth,
Yeah.
sorry.
Size.
The baby?
Outstanding.
Yeah.
And let me just,
Okay, well, retractors?
you want me to name them too?
Yes, please. I won't. Yeah.
1, 2 cents, 1, 2. Are these wreaths?
So these are called, they're two-prong retractors, but they're called Volkman retractors.
They're called what?
Volkman with a D.
Okay.
Yeah, yeah.
Yeah.
1, 2 on usually 1, 2, 3, 4 double entry pizza.
Mhm. And you said these are malleables, right?
Yes.
And how many sections do we have?
4 section, 2 piece.
Okay, and we have a yank out, so that makes 3, right? Do we have a yank out? It's right there.
Oh, yes.
So that's a countable suction thing. So 1,
Oh, okay.
and then, but it's, since this is 2, we say 1, 2, 3 suctions. So it's 3 pieces, right? And we have 2 knife handles. All right, outstanding. Did good. So we're looking at this in the order we're going to use this, right? So the first thing I want you to do is the 3/4. I know it's the other way, but 3/4. This is good. You got 4 towels. You got this ready to go. Do we have the surgeon's gown and glove? Don't worry
So
about
I'm
it.
gonna open the glove
It's fine, but in the future, when we always should have the surgeons, but it's always going to be on top, ready to go. When that surgeon walks in, we gown them real quick, okay?
Okay.
Awesome. Good job. So what I want you to do, don't break down. We'll break down together. I want to have Alexa go through a count with me real quick, because we're not going to have time for her to do it everything. You can. Did great. And I won't. Since I've seen what I need to see, we're going to move on from it. This everyone. Every time you guys come from Chrissy's classes, you guys are outstanding. Now, I've had classes before Chrissy. They were just a hot mess, and you guys are not that. So, you should be proud of yourself on that. Until I see Alexa, she'd probably be the opposite. But I'm just joking. I know she's good. You're all good. I can only add pressure right now. I think the little things about. I really want you guys to get used to. You got to use the bathroom. Not used to not the common names, but the actual name. Let me ask you a question. Do you know what these are actually called besides perforated, non-perforated cutout clamps? Do you know that one of them is called Backhauls and the other one's called Edna?
No.
So, okay, good. Do you know this is called Forster? Do you know that bandage scissors, what we don't have? Do you know
I did know the bandage scissors.
it's listers, right? You should know that, right? That's about it on it. Do you know that the right angles could be called mixers or Geminis?
Even though the mixers are different instruments.
And my point is,
That's what happens.
That's what happens.
Okay. Well, I mean, they're super close.
No, you're absolutely right. There is a difference of angles and stuff, but doctors are not. They'll ask for Gemini and.
Make up their own names.
All right. Yeah, we won't crowns, but yeah.
I didn't call that a dare today, and I need you to tell Chrissy that. They were Alice's today, not a dare.
No, I had to learn from her that there are bigger bites. Oh, you're right. These are dares because they're larger bites.
But I called them Alice's because I'm always told that these are not.
These are not. These are not.
She says that they're not.
Oh, I trust her.
Where's the trade? I'm like, these wider ones, I was going to say a dare, and I was like, just stop and say Alice before you get in trouble.
She's not. She's going to come over here and she's going to count with me, and then we're going to break this tray down. We're going to take a little break, and we're going to finish up with a cahoots. And then we're going to go on break a little bit so we can get ready for. I'm not trying to. We have a long day. It's our first day, so. But next week, Alexa and Gingy. You gotta help.
Want me to close it?
I'm gonna count with her, and then we're all gonna break down and get you ready to go, and then I'll let you guys take a quick little break, okay? And then we'll go finish up over here. Are you ready for a count? You don't have to scribe it. I want you to just do a count with me. So we're gonna do laps. No, Raytex first, okay? Go ahead.
Raytex. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Laps.
Laps. 1, 2, 3, 4, 5 laps.
Okay. Sutures.
Sutures. 1. There's just one in here?
Yeah. It's supposed to.
1.
Hypos.
Hypos. 1, 2.
Okay. A bogey tip.
Bogey tip 1.
All right. From your left to right on the stringer, tell me the exact names.
Left and right. Here.
Mm-hmm.
Maybe like 4, 3, 2, 32 numbers.
Can I show you how it's done?
Yeah.
So if you know what that is, right?
Like, could you do
I-
like what, 1, 2, 3, 4?
So I would go 1, 2, 3, 4, whatever they are.
Okay, yeah,
That's,
gotcha.
yep.
So just 1, 2, 3, 4. First, 1, 2, 3, 4. Non-first. 1, 2, 3, 4. 1, 2, 3,
Autumn messed that up. I don't know what she was doing.
4. What the?
It's a what the? It's a what the hell? Here, let me just.
You're like, let me just put it back in order.
There's so many curved ones. It's
Here, so I was just showing Autumn here. So we're going to establish something here right now. So I talked about a Kelly and a cryo, right? So do you see how the serrations stop right there?
yes.
So that's a Kelly.
The Kelly.
And the serrations on here,
They go all the
they
way
go all the way down.
Oh.
That's a cryo.
Okay.
down.
But for shits and giggles and for our own sanity,
Mhm.
if they're small, yeah, and let's call them mosquitoes.
Okay.
If they're medium sized, we're going to call them Kellys, straight or long.
Okay. Gotcha.
I just, for our own
So-
sanity.
1, 2, 3, 4 mosquitoes. 1, 2, 3, 4, 5, 6 curved Kelly. 1, 2 poker. 1, 2, 3, 4. Alice? Adair? Whatever.
Chrissy's ears are ringing right now.
I just thought she'd be proud of me that I actually called him Alice.
Make sure she knows. She always proud of- she always worried about you guys.
Babcock.
Yep.
1, 2 right angle.
Yep.
1, 2 reinforcer. 1, 2, 3, 4 needle holder.
Mhm. Yep.
1, 2, 3, 4. That's 5.
Is there 4 or 5?
Okay, I was like getting confused there.
1,
me see.
2, 3, 4.
I see.
1, 2, 3, 4. Yeah, there's 5.
Okay. You're a messer.
No, I wasn't. I'm blind. I'm old. I'm 50 years old. Okay. Hey, tell me the scissors names before you go.
Scissors names. Okay, so like here we have
Doctor's waiting.
no doctors waiting. Those cement scissors.
Or medicine bomb. Yeah. How many we got?
We have
One long, one.
just lay out one long one.
So we have one long, one short, right? So you have 2 medicine bombs.
Is this the short right here? Is that the short? The second one, the short.
That's it. So these are medicine bombs. What is this?
That's a curve.
Curve, Mayo, and a straight curve, right? So what are the forceps?
Forceps. We got the pickle. We have axillary teeth.
Mm-hmm.
More axillary teeth. Right teeth. Wait. Yeah. Pressure. Another red tip.
Yeah. Got a lot of rat teeth.
Yeah. The babies. And the longer the baby.
So why is there longer and shorter again?
Yeah, the longest.
And what about the retractors? And we're going to finish strong and go into the sunset.
We have 2 malleables.
This
This
is
is just the green.
that's what I did.
Yeah.
So break.
A green retractor is not traumatic. It's for thyroid. So this is a 2-prong or a Volkmann with a V retractor.
So this is also a vocal.
Mm-hmm. Yeah. It's just different ends on it. Yeah.
We have 2 cents.
Yeah.
Army Navy 2. We have double-ended Richardson. Are these also double-ended Richardsons?
There are, but they're just smaller and large, right? So we got 1, 2, 3, 4. If you want to specify medium and large, it's fine, but not important. Why is there small and larger Richardsons? Because you can start with a smaller incision, the incision can get bigger, right?
And full pieces.
All right. And is that all? Any ink out, right?
Yeah. Okay.
What do you guys call this? Malleables or ribbons?
Malleables.
Can be called ribbon too. So
Ribbon?
Yeah.
Oh, I heard that too.
you guys are good. Let's break this down. What questions do you have so far? I think looking at you guys, I'm not going to have you do all of that, like naming the instruments. But eventually, when we get up to the field, we're going to go quick with names. So it's going to be about muscle memory from here on out. I think anything different that I want. I don't see anything. You guys are doing towel rolls now. Evidently, she's told you to do that. A lot of people don't do that. I'd like you to set this up for a count. So get to this point, and then when I turn to you and are you ready for a count, it better look like this.
Okay.
That's it. To me, that's going to be a better practice of you. Reason is because it's how it's going to go in live. If you didn't have it organized within reason, and you do a count all hosh posh, that patient's rolling in the row. Now you have to hurry. Rather get to this point quickly, get a count, and you're good to go. Maybe you can break scrub and help a patient moving over to the table or something. Right? Let's break this down and take a break and never come back. I'll see you later.